Namaskar, I am Dr. Subhayan Mandal, neurosurgeon of Calcutta, is going to discuss the role of lacosamide in the treatment of epilepsy and what a neurosurgeon should think and should know about lacosamide. Why I am doing so? Because number one, we are often acting as a primary physician, primary doctor in the treatment of epilepsy for our patients. Second, sometimes we got referral from our epileptologist friend to opine on epilepsy surgery. So, a neurosurgeon should have a good knowledge on the different types of anti-epileptic drug. And lastly, as a neurosurgeon, we have some responsibility to avoid the people of the society from so that they get out from the bad stigmata of epilepsy. Let me to allow to share my screen for discussion of lacosamide in the treatment of epilepsy. As I have already told, I am a neurosurgeon of Calcutta, and today's topic, what I am going to discuss is the neurosurgeon's understanding about lacosamide. See, lacosamide, in this our discussion, our point of discussion will be what is lacosamide. Second, the executiveness of this molecule in terms of pharmacokinetics and pharmacodynamics, the side effect profile, the future direction and off-the-label use of lacosamide beyond anti-epileptic drug, the holistics about the molecule. In this picture, you are seeing that this is the mechanism of action of lacosamide. This is a picture that is showing that how the neuronal excitation and presynaptic potential is going to the postsynaptic membrane and the basic mechanistic representation of epilepsy. Now see here, a number of channels have their role in genesis and in modeling of the epilepsy and also the target of different therapeutics. Now lacosamide, they act on the voltage gated sodium channel, they inhibit it and thereby they prevent hyper excitability of the neuron and thereby they subserve the role of anti-epileptic drugs in preventing epilepsy by preventing the hyper excitation of the neurons. From the previous diagram, we have known that lacosamide blocks sodium channel and these are the slow inactivation of the sodium channel. It is unlike with the other classic sodium channel blockers that enhance the fast sodium channel inactivation. The second novel mechanism that has been discovered recently is that lacosamide, by interacting with the CRMP2, that is collapsing response mediator protein 2, they have some role in controlling the chronic pain, mostly the diabetic neuropathic pain, by some modeling on the neuronal differentiation and axonal outgrowth. Now this is canonated in this paper that the novel dual mechanism of lacosamide do exist, and this is the date of publication you are all seeing here from the screen. Okay, after that, therefore, the pharmacokinetics and pharmacodynamics when being discussed of the lacosamide is that this drug has an excellent oral bioavailability and they have clinically insignificant protein binding. They used to get converted in liver to inactive metabolite. About 40% is excreted unchanged in urine, low pharmacokinetic interaction, and their metabolism is usually limited by CYP2C19, in contrast to the most of the others that used to get metabolized through CYP450. It has a beautiful pharmacokinetic profile is that the rapid dose titration is possible and it has a T-half of 13 hours. Provisional therapeutic range of serum concentration is very good. That is a big therapeutic window, that is 2.5 to 18 milligram per liter. I am not going to discuss more detail on the pharmacokinetics and pharmacodynamics because my lecture will be more and more practical oriented. So, if you compare the all antibiotic drugs, specifically lacosamide is endowed with a good oral bioavailability. It has a low protein binding. 60% got metabolized, rest unchanged urine, in the intermediate half-life, and endowed with no or minimal pharmacokinetic drug-to-drug interaction. And if you compare it with the jonisamide, that you see that the jonisamide is also a good drug, but it has a moderate interaction profile. And also, you see the adverse effect profile of jonisamide is also more than lacosamide. Now, let it compare with the levetiracetam. Only the difference is that levetiracetam has a very short half-life. There's a long, it has an intermediate half-life. Both have very minimal interaction. And oral bioavailability of both the drugs are good. If you compare it with the brivaracetam, that metabolism of the brivaracetam is very extensive. Therefore, it has a very short half-life. Whereas lacosamide has an intermediate half-life. It has minimal pharmacokinetic interaction, and brivaracetam has moderate pharmacokinetic interaction. Going to the next slide, there is an interesting thing that if you see the racial variation of lacosamide serum concentration, it has been found that Afro-Americans or the black people, they require a higher dose of lacosamide per kg body weight to reach similar levels in white patients with epilepsy. So, white people are usually the slow metabolizer of lacosamide than the Afro-American and black people. This is a beautiful paper that what is the effect of lacosamide in pregnancy and breastfeeding. This was being published in Science Direct Journal, and in 2020, you see this. The conclusion drawn in this journal is that the lacosamide worldwide pregnancy register has provided consistent and increasing information about the efficacy and safety of older antiepileptic drugs during gestation, while data are lacking for many of the newer generation. And it has been found that 3 maternal exposure was registered, and none of the mother have come up with an abnormal child. Now, let us discuss something about what are the adverse effects. You know that there is a major adverse effect of lacosamide is that it makes some people dizziness, at least around 10 to 15%, 17% of the people sometimes found on first 7 doses dizziness. Other adverse effects could be headache, diplopia or blood vision, nausea, vomiting, increased peer intervention in ECG, idiosyncratic reaction, chronic effect, and teratogenicity of lacosamide is still to be determined, because more and more people should be subjected to lacosamide therapy before you conclude that it has a teratogenic effect or something else, or it is harmful to the breastfeeder. But primarily in pilot project, it has been lacosamide is found to be safe in pregnancy and breastfeeding and being categorized as category C. Now, if you compare head-on-head between the lacosamide and carbamazepine, this is a beautiful trial, Wiley Library, published in Wiley. It is a double-blinded, non-inferiority trial, a phase 3 randomized, double-blinded, non-inferiority trial that has interpreted that treatment with lacosamide met the predefined non-inferiority criteria when compared with carbamazepine CR. Therefore, it might be useful as first-line monotherapy for adults with newly diagnosed epilepsy. This is the Kaplan-Meier curve and the plotting of different effects head-on-head uh, trial effect of lacosamide and carbamazepine. I am not going to detail of it. Actually, lacosamide in different trials it has found that lacosamide is comparable to carbamazepine in control of partial epilepsy. Now, let us, it is a burning topic. Which one is better, lacosamide versus levetiracetam? It is too early to comment, but there is a beautiful journal. They have discussed the long-term efficacy and safety of lacosamide and levetiracetam monotherapy in elderly people with focal epilepsy, a retrospective study. The conclusion drawn here is that epilepsy management in elderly patients is often challenging. In this retrospective real-life study, the efficacy and the tolerability of LCM, that is lacosamide, as monotherapy was favorable even at low dose in older patients and comparable with levetiracetam with a high rate of long-term seizure freedom. Considering the frequent comorbidities and the risk of drug-drug interaction, lacosamide monotherapy may be a valuable opinion, if not better, in elderly patients with focal onset epilepsy because of its favorable pharmacokinetic profile. Now, this is a letter and a comment issued that is also they have some author has written to the Willy that lacosamide monotherapy for the newly diagnosed epilepsy. It was the first time lacosamide used by some people. This author as monotherapy. So nowadays, it is going to be accepted as a good, if not a very valid alternative monotherapeutic for epilepsy. This is the paper of Laconote study published in Epilepsy Research in 2018, and they have concluded that the results of real life settings show that lacosamide to be efficacious and safe when used as fast add-on therapy for the focal onset epilepsy. Most adverse events were mild and or transient. So lacosamide is a very good alternative for the treatment of uh, as a monotherapeutic treatment for the epilepsy. Now it is another interesting paper, that is use of lacosamide child and adolescent for drug resistant and refractory status epilepticus. This is really a breakthrough, that is this new generation anti-epileptic drug could be used in the child and adolescent for the drug resistant and refractory status epilepticus. This beautiful paper was published in Seizure Journal in 2018 and has drawn the conclusion that current evidence shows that the lacosamide is a good option in pediatric patients with focal drug-resistant epilepsy and refractory status epilepticus as an add-on therapy given its efficacy on seizure control and safety profile. The use of lacosamide in Lennox-Gastaut syndrome. I am not going to detailing on the Lennox-Gastaut syndrome. These are syndrome where the patient, this is a syndrome, patient usually experiences syndromatic, it has been classified under the syndromatic epilepsy as per the classification system of ILAE 2017. So lacosamide could be used as a good drug in controlling the seizure of Lennox-Gastaut syndrome. Uh, the use of lacosamide in Lennox-Gastaut syndrome also shows conflicting data. Large randomized trial studies in the pediatric population are necessary to substantiate this finding. There are some people they have done a small trial and that has been found that it is also good for the treatment of Lennox-Gastaut syndrome. But before you can draw a final comment, more and more people are to be registered and to be studied uh, before concluding that lacosamide is very, very efficacious. Now, this is the last beautiful protocol of Massachusetts General Hospital published in 2015. That is the protocol for the treatment of people with status epilepticus. If you see the protocol, the next page, you see that you can choose from the following, may be used in combination, that is in status epilepticus, in second line therapy, when the status is not being controlled after 10 minutes in the first line therapy, this is the first line therapy, then that is the lorazepam or diazepam, then you can use any of these: valproic acid, levetiracetam, phenobarbital, phospheniton, or lacosamide. You see here the lacosamide dose is 400 mg to be transfused over 5 minutes, and you require a pre and post infusion electroencephalogram to validate that it has controlled the epilepsy. You see the levetiracetam dose is here, maximum rate is 100 milligram per minute. That is, you can give up to 1200 milligram of levetiracetam slow IV in patients with a body weight of 60 kg. Now let us discuss on the extension. Now in extension, that is a beautiful syndrome, Movan syndrome. Movan syndrome is a rare disease characterized by a combination of peripheral nerve excitability, hyperexcitability, autonomic dysfunction, and encephalopathy that is postulated to be autoimmune. And these people usually shows they have hyper excitable peripheral nerves, and in these people Movan syndrome, lacosamide is found to be very much useful in treatment of the hyper excitable peripheral nerves. So lacosamide could be used in treatment of Movan syndrome, in treatment of hyper excitable peripheral nervous system in people suffering from Movan syndrome, along with rituximab. Actually, rituximab is indicated for the treatment of Movan syndrome. Now, another important thing is that tuberous sclerosis. These people has candle dripping appearance on MRI. They have tubers, cortical tubers, subcortical tubers. Like these people usually experience yes type of seizure. Now you see the lacosamide could be used effectively in controlling the yes seizure in patients with tuberous sclerosis. This is the journal published first, reported in 2015. Later a number of papers are there. They're telling the role of lacosamide in controlling the people suffering from yes seizure and having cortical tumor. That is, they are the candidate of tuberous sclerosis. Now let us discuss some issues of off-the-label use of lacosamide. You'll be astonished to know that lacosamide has analgesic property. I have already discussed it, that CRMP2 it can block CRMP2, and therefore confer some kind of analgesic property by remodeling the axonal outgrowth. And lacosamide, this is the first paper they have given that lacosamide could be used in diabetic neuropathy, and they have very least potential of abuse. And this is the paper published in the European Journal of Pain that said that the long-term oral lacosamide in painful diabetic neuropathy, they have studied it 2-year in open label extension trial design, and they have come into the conclusion that long-term efficacy of safety profile efficacy of lacosamide observed in this trial support its continued development for the treatment of the painful diabetic neuropathy. It is really an interesting phenomenon of lacosamide, that an anti-epileptic drug, newer anti-epileptic drug, it can be used in the treatment of painful diabetic neuropathy. Now, this is a letter issued by this gentleman that lacosamide could be used in paroxysmal kinasinic dyskinesia. There are some people, they experience paroxysmal kinasinic dyskinesia. It has been found that if you use lacosamide in these people, they get some read of this kind of disorder. Now, that is another interesting phenomenon. You will be astonished, you will be delighted to know that in vitro, lacosamide and brivaracetam has shown some anti-neoplastic effect, and therefore they could be used in patients suffering from human glioma and coming with a focal seizure. So, in sucking about lacosamide, facts is that it is an executive molecule. The safe molecule, it has a very minimal side effects and is a very supreme molecule. And supremacy not only as antiepileptic as an antiepileptic drug, but also beyond the antiepileptic drug, that it could be used in diabetic peripheral neuropathy, painful diabetic neuropathy. Also, it could be used in Marfan syndrome. It could be used in the patient of tuberculosis having a seizure, that's the atypical drug resistant seizure, and also it has confirmed some antineoplastic activities. And of the level, it could be used in a number of conditions that I have told earlier. So, with this, I am going to conclude my seminar, small discussion on lacosamide. Thank you all. Namaskar for your patient hearing my lecture. Thank you all again. Stay safe. Treat your patient carefully. You are the last hope of this humankind, this human race, in fighting all the things. Thank you all. Thank you all again. Namaskar.